Mandatory overtime. Learning outcomes. The learner will state one QSIN competency related to mandatory overtime. The learner will know where to find their state's law regarding mandatory overtime. The learner will state two facts regarding why the law regarding mandatory overtime is important to their current nursing practice. QSIN competencies. Patient-centered care. Mandatory overtime can decrease patient satisfaction. To ensure the best outcome for each patient, nurses should not be forced to work over their scheduled time. Teamwork and collaboration. When staff is forced to work, there is a decrease in staff satisfaction, teamwork, and collaboration. Evidence-based practice. Evidence shows that there are negative patient outcomes as a result of mandatory overtime, which is why there is now a law regarding overtime. Safety. There is decreased safety for staff and patients when nurses are forced to work over their scheduled time. What is mandatory overtime? Prior to 2009, employers were able to mandate nurses to stay if their unit was understaffed. This required nurses to work over their scheduled time and for longer shifts than they were scheduled for. With the current law, nurses who work a 12-hour shift are entitled to 10 hours off-duty time. The nurse can volunteer to work more, but cannot be mandated to work more. Pennsylvania law. Started in July 2009. This law was made so nurses and other direct caregivers would not have to work over their scheduled shift. Overtime is not mandated but can be volunteered for. Exceptions to this law are national, state, or municipal emergencies, natural disasters, acts of terrorism, or widespread outbreaks of disease. Mandatory overtime is only allowed after all other reasonable efforts are made to obtain staff. Importance to nursing practice. This law is important to nursing practice because mandated overtime can reduce patient satisfaction, cause an increase in patient adverse events, medication errors can occur, and it can cause an increase in patient mortality. Why is this important to you? Mandatory overtime can decrease patient and nurse outcomes. It is important to know your state's law regarding mandatory overtime so that you know your rights as a nurse. If you follow this link, it will explain each state and what their mandatory overtime laws are. Discussion question. Do you feel that the current law is sufficient in protecting nurses from being mandated? Or does your current employer find loopholes in the law? Closing statement. The law regarding mandatory overtime is necessary to ensure safety among nurses and the care they provide to their patients. Forcing staff to stay more than their scheduled time can lead to decreased job satisfaction, nurse fatigue, and an increase in job-related injuries. These issues decrease nurse retention, which make the initial issue of understaffing worse. Positive work environments and adequate nurse-to-patient ratios will provide an atmosphere that increases job satisfaction and nurse retention. If overtime is needed, a positive work environment will increase nurses to volunteer their time, so mandatory or overtime is not an issue.